Hi, I'm Dr. Braha. I'm a board-certified gastroenterologist here in Brooklyn, New York. Today, we're here from Zirmed to talk about colonoscopy and colorectal cancer screening. Early detection is the key to colon cancer. By finding cancers early, we can often cure them, especially with colon cancer, where we can prevent colon cancer by removing polyps. These are small growths that we can find during a colonoscopy in the colon. By removing them, we can prevent the development of colon cancer. So today we're here, instead of in the studio, at Brooklyn Gastroenterology and Endoscopy Associates, here in the Sheepshead Bay section of Brooklyn on Emmons Avenue. We're here today in the surgical center where we have patients who have come for screening and surveillance colonoscopies. If you're watching today and you're 45 years old or older, you are eligible for a screening colonoscopy. This is where we take a small camera while you're sleeping, place it into the rectum, and go through the entire colon looking for colon polyps. We don't feel colon polyps, and oftentimes we don't even feel or know that we may have a colon cancer. So early detection and prevention is the key to preventing colon cancer and curing colon cancer. You will see today colonoscopies where we go looking through the colon and find such conditions such as hemorrhoids or diverticulosis and colon polyps. We find these in 30 to 40% of patients and can remove them during a colonoscopy. As I said, the procedure is painless and takes about 15 minutes. So if you're over the age of 45, if you have a family history of colon cancer, if you have any symptoms that might be associated with colon cancer or other significant colon diseases, such as Crohn's disease or colitis, we want you to go see your provider, your primary care physician, your doctor, and ask them if you're eligible for a colonoscopy. Some alarm features that we want to look out for that would prompt us to do a colonoscopy at any age would include bleeding, red blood in the stool, red blood noted in the bowl or when you wipe, black or dark stool, diarrhea that doesn't go away after maybe a week or two, and also weight loss or abdominal pain that goes unexplained. If you have any of these, please go and see your primary care physician to determine whether or not you are eligible for a colonoscopy. But anyone watching today over the age of 45 should be screened for colon cancer. So thank you for watching, and I hope you will learn from our procedures today where we go and perform colonoscopies on our patients, searching for colon polyps and for colon cancer. We'll start here in a second, Greg. 1 second. Hi, I'm Dr. Braha, board-certified gastroenterologist today with Zirmed, and we're doing colonoscopies today on patients who are being screened or surveilled for colon polyps or colon cancers. Some of the patients today we see have never had a history of a colonoscopy, and others have a history of colon polyps or colon cancer. We start doing screening colonoscopies at age 45 on all patients that are eligible. Anybody who turns 45 should see their physician to discuss screening options for colon cancer. We can prevent colon cancer by removing polyps, little small growths that develop in the colon as we get older. And so at age 45, we should all see our physician and talk about how to screen for colon cancer. Here we are today in a colon. We have just reached the beginning of the colon with the camera. This is the appendix right here. This is called the appendiceal orifice. Once we see this, we know we've reached the beginning of the colon, and we begin pulling backwards with the camera, searching for polyps. During the procedure, patients are sleeping, they're comfortable. They are receiving medications through the intravenous line, which help them sleep, and they do not feel the colonoscopy. They're not aware that the procedure is being done. The procedure takes about 15 minutes, and we are able to search for colon polyps and at the same time remove them. And by removing these colon polyps, we can reduce the risk of colon cancer. We are making our way through the ascending portion of the colon. This is the portion of the colon that rises up from the bottom of our bellies on the right side, moves up the right side, just under our chest, and then the colon will make a turn and come across our upper abdomen in a portion of the colon called the transverse colon.
And as we remove the camera and we pull backwards, we slowly and carefully search each portion of the colon looking for colon polyps. Patients often will not feel that they have a colon polyp. They will not have symptoms related to the polyp. And that's why it's called a screening procedure. A colonoscopy at age 45 is done on all people, regardless of whether they have a symptom or not. And here we are pulling through the transverse colon, the portion that crosses across our abdomen. And we are searching for any signs of a polyp. We're looking for colon cancer or any other diseases that we can see in the colon. And so far here we've had a beautiful view. This is a nice clean colon so far. There is normally some yellow liquid or greenish liquid that we see in the colon. This is part of our intestinal fluids. We suction it to clear the colon so that we can search for polyps. If we needed to, we have the ability to wash the colon a bit. We can squirt water into the colon and then suction it out to help clean areas that may not be so visible. The risk of colon cancer in somebody's lifetime is about 5%. The risk of developing a polyp here in our practice, our statistics show that between 30 and 40% of patients have a polyp. And so polyps are quite common. That's why we want our patients to come see us when they become eligible for screening. We can do a colonoscopy. We can remove that polyp and reduce the risk of colon cancer and death from colon cancer. So it's a very important exam. Patients often fear the exam because of the day before when they have to prepare. 24 hours before the procedure, we switch to a clear liquid diet. And then in the evening before the procedure, and sometimes in the morning before the procedure, we drink a medication that cleanses us. It cleanses our intestines and our colon. And we go to the bathroom a few times where we may see some loose stool and then clear liquid coming out, a sign that we've cleaned our colon. It's a painless preparation. And while patients often fear it, it's not that difficult. And the risk of colon cancer and the risk of having a polyp that causes cancer is quite high. And so it's very important for us to take the time, prepare for a colonoscopy, get ready for a colonoscopy. And then once you come in for the colonoscopy, it's a painless process. We place an IV, you fall asleep with some nice sedation, and you will not feel the colonoscopy. After the procedure, patients are picked up by their family or friends, and they can eat right after the procedure. They can go for breakfast. And we are here still coming across the transverse colon. We're searching for polyps, looking very carefully. We have a big staff here in the room. When you come for a colonoscopy, you'll meet with an anesthesiologist. We have technicians. We have nurses. We have a full team here to help take good care of our patients and ensure that they have a safe colonoscopy, a high quality colonoscopy, comfortably, close to home. So as you can see here, we're suctioning up some liquid that is normally found in our intestines. This is composed of our gastric and intestinal secretions, our bile, which can make it look yellow or green in color. This is normal. We're suctioning whatever we see here so that we can detect the polyp. And we're carefully pulling backwards through the colon. We are inspecting. We look in 360-degree view around the entire colon, up, down, left, and right, searching for polyps. So this is an area of the colon where this patient had surgery before for colon cancer. And we can see here where they reattached the two good pieces of colon together. In between, they removed the colon cancer. And we can see this little rim here, this line where they put the colon back together. They sutured the colon back together. This is the area of surgery. You could even see a little bit of the suture material right there. And this looks like a healthy colon. This patient, luckily, is a survivor of colon cancer, and we continue to frequently check the colon to ensure that there's no development of new polyps of colon cancer. And it is just so important to have a colonoscopy done to prevent cancer in the first place. Now we are here in the rectum. We are here at the end of the colon. Patients always ask about hemorrhoids, which are noted here. There's a plexus of veins, which is normal at the bottom of our rectum. And this was a good colonoscopy. We did not find any polyps. We did not see any signs of colon cancer. And this patient will be able to go home in just about an hour, go have breakfast, and enjoy their day. So I'm Dr. Braha with Zermed, and I want to thank you for watching this very important video explaining how colonoscopy is done, the painless nature of the procedure, only about a 15-minute exam where we can remove polyps, we can detect cancer before patients even have any symptoms. So thank you for watching, and stay healthy.
Okay, we're done.